First, we have to position the patient. Wherever there is fluid, that side should be present upwards and the other side should be downwards. And then we'll use the ultrasound to see and to locate the effusion. So after that, once we have located it, we reconfirm it with a needle. We just introduce a 10 cc needle and just take the sample out. After finishing this, we clean the patient properly and we drape them with sterile cloth sheets. After properly draping the patient, we give a nick to the marked side previously, which the side which we have marked it with the ultrasound in the starting of the video, and which has been reconfirmed with the needle. There we give a nick, just incising the skin. Afterwards, we do blunt dissection into the subcutaneous plane, the muscles, etc. Only blunt dissection. Once the blunt dissection is done and the pleura is pierced, we use a trocar, that is a trocar, and we insert into the lungs, and then we put the tube, thoracoscope. So this is a scope with a camera attached to it, and we'll be visualizing the pleura in the monitor, which is over here in front of us. On the, towards our right side, we had it over here. So we'll have pleural effusion. So we are doing suction intermittently. And then we are visualizing all the pleura, all the sides of the pleura, the apical pleura, the mediastinal pleura, anterior, posterior, diaphragm. This is how the fluid inside the pleura looks. If we see, we are visualizing properly the parietal pleura, that is the pleura towards the rib cage. The pleura which is on the lung, we call it as a visceral pleura, which we generally don't touch it. Once we see any abnormal thing on the pleura, then we localize it, we take the biopsy forceps, and this is how we take the biopsy. So we take it in a peeling manner. So we are catching hold of the abnormal tissue and we sweep it either towards the right side or left side rather than pulling it. So once the procedure has been done, then we'll be placing the ICD tube to the trocar side and then we'll be suturing it. So what we have used over here is a purse string suture. Different types of suture techniques can be used. So once the suturing is done, then we will be connecting this tube to an underwater drain so that no air from outside will go inside the lungs. Thank you.